So we're here to talk about the regulation or lack of regulation and licensing with regard to non-surgical aesthetic treatments. Tell me what the situation is now. Give us an overview of what regulation, what licensing requirements exist when it comes to non-surgical aesthetics treatments.
So when non-surgical aesthetic treatments, we would say include injectables such as botulinum toxin injections or dermal filler injections, some forms of threadlets, and perhaps peels, skincare, lasers. It's usually done under any local anaesthetic or cream anaesthetic comfort. Now, anyone can do that.
Anyone?
Absolutely anybody can do it. Okay? There is only one of those treatments that requires a prescription, and that is the botulinum toxin treatments.
Botox, as we know.
Botox, yeah. Exactly. That requires a prescription because it's a prescription-only medicine. But who actually administers it can be anybody who's received a training certificate.
Why does this give you cause for concern?
Well, clearly this means that you can go to any person without any medical training whatsoever, except for maybe 2 or 3 hours on how to administer botulinum toxin, and they can inject you just because they've been shown a template on what to inject. There's no deeper understanding of the pharmacology of the medicine. There's no deeper understanding of the anatomy that we're injecting into, the individual's balance of the face, the individual's health risks, health concerns. And also, there's no actual teaching on these short courses of managing complications. What
sort of complications can there be then? And how regular really are they? Because so many people are having these treatments these days, and you don't see people walking around with sort of disasters, do you, very often?
Well, regarding Botox type complications, thankfully they are short-lived, okay, because the drug itself is short-acting. It lasts for about 3 or 4 months. However, with side effects of those are droopy eyelids, droopy brows, blurred vision, droopy mouth, uneven smiles, headaches even, weakness of the head and neck. And if you maybe get your hands on a form of Botox that isn't the official aesthetic or medical Botox, that there are some counterfeit versions available online, you could be overdosing, and that could potentially lead to death, because what botulinum toxin does, it temporarily paralyzes muscle. And in aesthetic use, we use it to temporarily paralyze muscles in the face, for example, particularly around the eyebrows, for example, but it's very locally acting. But there are other forms of Botox that are actually so highly concentrated that if they dilute it in the aesthetic dilution, you could potentially kill someone, because it will paralyze the breathing, the chest muscles, the respiratory muscles, as well as the heart muscle.
It sounds terrifying, but how regularly do any of these more extreme reactions or problems actually occur?
Thankfully, those for botulinum toxins, the extreme ones are rare, and I suspect that's why it's people, the insurers who insure these non-medics to treat, see it as a low risk. And so this is one of the issues, is that how is it unregulated? How can these people do these treatments? At the end of the day, if they've got insurance, they're covered. And it's been shown that most non-medics, their level of insurance is much less expensive than a medic's insurance for the same procedure.
So that's the botulinum
toxin.
As Botox as we know it. But you also mentioned fillers, which are not so short-acting, I'm guessing.
Well, dermal fillers are not prescription-only medicine, and that's something that medics on the whole have been really campaigning for to get, because they are much more dangerous than Botox strip injections, because they can leave permanent, lasting damage. The reason why? They can be accidentally injected into blood vessels, and blood vessels in the face, if you do that, the gel, which is the dermal filler, can travel until it reaches a fine artery or a dead end, and that dead end could be the back of your eye, and that could lead to permanent blindness. The rates of blindness have been increasing over the last 10, 15 years since it was first reported.
Because of dermal fillers being used?
Because of dermal fillers. The other thing which is commonly seen are complications in lip treatments. Many patients feel that a bruise in a lip treatment is just a bruise, and that is probably the case in most cases. But a bruise will only last 2 or 3 days or maybe a week at most, and it shouldn't be very painful. I see patients who have reported bruising in previous treatments, and when I ask them about that in detail, they say, oh yes, it was black, crusty, it had bubbles on it, and it was quite painful. And they were fobbed off by their inexperienced and uneducated injector that this was normal and just a bruise. What that was is highly likely to be tissue death caused by a blockage of a vessel, and that would have left them the scar that I saw there for them.
Again, these sound like very, very worrying and unpleasant complications. But I question you, how often are these things going wrong?
In practice, I see complications from other practitioners probably about 2 or 3 times a year.
So not that often, really, is it, considering how many people...
They're the ones that come forward.
Okay.
They will come to me. Some will go directly to a plastic surgeon. At the hospital, for example, they might go to their GP. So that's just what I see. But there are some go to A&E.
Clearly people are prepared to take these risks, though. And if it does go wrong, what are the options? I mean, I'm asking you to answer a very big question quite simply. I realise that.
When something goes wrong, they should definitely go back to their injector first and insist that they be seen, not fobbed off over the phone by text or messaging, because this is often how they're communicating. 2, if they're not seen straight away within 24 hours, then they should go and see the nearest aesthetic doctor or plastic surgeon or dermatologist. Because unless the medical professional has been experienced in these treatments, they're not going to be as helpful. So they go to a general A&E or a general practitioner, for example, who has no experience. They're not going to be as experienced as someone who's more experienced in these. And so someone like myself or all my peers and colleagues who have been trained for years and years, not only just in general medicine and surgery, but also in aesthetics and dealing with the complications and seeing these being reported openly amongst peers all over the world, we gain experience and learnings on how these can be managed and handled.
You mentioned insurance that practitioners can buy or should have. What does that mean for the client if that insurance is in place?
Oh, maybe that can mean that they can sue that practitioner for their any corrective work that needs to be done, and perhaps some psychological compensation or whatever. But what we tend to see is that the people that go to maybe say a non-medical practitioner or a cheap place to go, for example, and something minor goes wrong or something major goes wrong, whatever, they almost go, well, what did I expect? I took a risk. They're not going to know anything. But if the same complication happens, and it can happen in the hands of an experienced practitioner, in fact, the ones...
A medically qualified one.
An expert, because they're the ones that are reported in the medical journals. The cowboys, as we have it out there, do not report their complications.
Do you?
I do, of course we do.
How often do you have complications?
Which are reportable? I haven't had any for about 2 years.
Can you, without mentioning anybody in particular and identifying anybody, what was the nature of the complication?
With a dermal filler type product, a collagen stimulating type product, we had a known complication that can happen where the body just reacted and rejected the product we inject inside. So they needed a course of medication to switch off that reaction, and that comfortably sorted itself out within about 6 to 8 weeks. But that's 6 to 8 weeks of someone coming for an elective procedure.
When people come and see you, perhaps for the first time, how often do they ask you what could go wrong and what would you do to put it right?
It's not, I would say it's the most common concern, but not everybody asks. So on our consent form, we have that. I gauge when I'm consulting with someone and I'm assessing them, and I'm assessing one, not just their physical suitability, I'm assessing their psychological suitability. And what I mean by psychological doesn't mean I'm looking for someone who's unstable. I'm looking for someone, clues like, what would you do if you had a complication? How would you manage that? What sort of reaction would you have? What would you expect to do? And we're trying to see someone's risk tolerance. Yeah.
When you are assessing people, though, as well, how important is it for you to gauge how much work they want to have done and how quickly, how realistic they are about what can be achieved? Because the temptation for any business to upsell and encourage people to have more is obvious, isn't it? If you're in business, you're making profit.
But if you're a doctor and you're following the code of a doctor, you're doing what's in the best interest of the patient. And that's the first and foremost philosophy and ethical belief that I have. And that's what we do. What's in the patient's interest, not what's in my interest.
But yet we've heard in other cases that have obviously made the news where even highly qualified doctors have either made mistakes or carried out treatments that are questionable. So the fact that you've gone to a doctor isn't necessarily going to prevent all issues, is it?
No, it's not, but it's going to cut the risks down. Because obviously what tends to make it to the news are the extremes.
What some people might say is, well, look, this is protectionism by the medical profession, that you want this space all to yourselves and you'll charge more probably than a salon on the high street or somebody who's offering treatments from their home. How would you answer that charge, that this is all about the medical profession running a sort of protection racket, if you like, to push other people out so you've got that space for yourselves?
Well, I would counteract that, because would you go to a non-medical practitioner, whether it's beauty, hair or whatever, and go there for your COVID vaccinations or your travel vaccinations? Where would you go for that?
Some of it's about risk, perception of risk, as you said, maybe a lack of understanding of quite what it is you're dealing with. But it's also about cost. If people are seeing these ideas of what beautiful looks like, and it's becoming more and more acceptable to have treatments, invasive but non-surgical treatments, some people can't afford the kind of prices that some clinics charge. You've already said that some are more expensive than others. So how do you mitigate against that? The fact that people are going to be drawn perhaps to a bargain that's being offered to them.
The question we should be asking is that it shouldn't be available, because these have medical complications, these procedures. Okay? They have real risks. And so they shouldn't be available. The fact that they are allows you to ask that question. Okay, but they're not.
But that's the reality. I'm asking a question that's based on the reality. You're arguing against reality,
yeah. But I also know that it's unlikely to change.
Well, that brings us on to what the government has been talking about. Last year, there was a proposal from the government to bring forward guidelines which would eventually lead to a consultation that was supposed to be happening fairly soon. These guidelines are supposed to be published with a view to introducing licensing. Now, what's your understanding of what change that might bring about in terms of safeguarding clients in the future? I mean, we seem to be quite a long way away from any kind of regulation and licensing, but it's at least being talked about.
I'm all for any form of regulation that raises the standards and protects the public from rogue practitioners. Absolutely. There is already a form of regulation in private medicine regulated by the Care Quality Commission. Unfortunately, aesthetic treatments do not fall under that remit, but more invasive treatments such as cosmetic surgical treatments or the thread lifts now, for example, have been moved into that regulatory regulation. So I would say that should just move the aesthetics, injectables and lasers across to the Care Quality Commission regulation, because that's already existing there. They've already got the template there. We're already using that. What that framework does, that checks that your premises are suitable, clinically safe and sound, and we look at infection control. 2, your procedures are well documented. Okay, you keep count and stock of your medicines and all the rest of your drugs. You monitor complaints. You monitor consents. Everyone has written consents. Your training's regularly reviewed at. For example, doctors have to do an appraisal every year and get revalidated every 5 years. And that's by an independent doctor assessing we have to stick to a professional development program every year.
And the reporting of when things go wrong.
And the reporting of when things go wrong. That is not compulsory, though.
But what you're talking about would put hundreds, if not thousands of people or businesses out of business.
How many of those are legit?
Well, under current regulations, they all are, aren't they?
How many of those are legit?
I can't possibly answer that question. And I don't think you can either.
No, but my point is, these businesses that aren't conforming to regulation.
We don't have the regulations, though, to conform to. It's a vicious circle, isn't it, in that respect, from your perspective?
I suppose, I'm an idealist, I guess, and that's the problem. I live in a world where I like to be honourable, ethical, and do what's right for my patients. That's what I've always had, my core belief as a medic. And as a medic, that's what you believe. Generally speaking, there's a few rogue ones out there. We all know that, okay? But on the whole, doctors are always working in their best interest for the patients. It's not about the profit. That's not the primary driver. Whereas a non-medical business, of course, it's all about the profit. Now, if this was costing me more money to run than
you're making,
I'm not going to do it, of course. But at the end of the day, I'm not sitting here focusing on profit. I would turn patients away. I'd turn patients down for treatments to maintain their appearance. I always ask about their budgets. I'm not interested in upselling. I have patients come to me and they report spending 10 times as much as what I would charge for a treatment elsewhere. And I question, why did they do that? And they said because they were upsold. Some people like that shopping experience. They perceive it as that, whereas at the end of the day, I see this whole area as an area in medicine, as a specialist area in medicine. And so I have to understand why the patients come to me, what are their concerns, what's their previous medical history, and see how can this patient, what can I do to help this patient? If what they're asking for is not going to be in their best interest, I have to explain that to them so that they understand.
It sounds very noble, all of it. And surely, though, behind a lot of this is vanity. It's also what we see on social media in particular, this idea of perfection. How worried are you by that people are seeking something that is probably unattainable?
I think there has been a recent trend on that. I've got a feeling that trend's dying off a bit. I think people are more concerned actually about feeling good for themselves, feeling good. It's not about looks so much. I offer a patient, I can give you flawless skin, which is generally unrealistic. Okay, but if I can say to them, I can give you the lips of as if you were 20, the skin, maybe you're 30, and they won't look right. They won't look balanced. The whole point of what we're doing in aesthetics is to help people feel better about themselves. And the people that come to me or come to see any doctor, okay, or nurse or health practitioner that offers aesthetic treatments, is that they are bothered enough about their appearance that they're seeking a medical procedure. Okay, this is not the ones that go to the beauty places don't see it. They see it more as a trend, as a fashionable item. Oh, I want big lips today. Okay, That's all right. It's not permanent. If I don't like it, I can get rid of it.
Not,
It's like a
not
handbag.
that easily.
Okay. Whereas the people that come to me tend to be more concerned about the quality of their skin. Yes, it is appearance-based.
Well, that's what they tell you anyway. Do you believe them?
I think it's part of it. I do, because I see that when we improve, everyone starts off maybe with trying to reduce the appearance of lines and wrinkles. Okay, trying to look less old. Okay,
Why are we so worried about that?
I think.
Why are we so worried about that? It happens to nearly everybody, doesn't it?
Well, everyone who lives long enough, it happens to. Absolutely. But we're worried. We're programmed to worry about that. That's always been in our nature.
Has it?
Yeah, even the Egyptians have been worried about it for years, and even before that, beauty, looking your best. I think it's to do with maybe just the core. Being attractive to the opposite sex or to whoever you would want to be attracted to. I think that's poor. It does help us feel better about ourselves. That's something that's been programmed into our thinking. So that's always there. That's always there. When people feel better about their skin, now it could be their mood lifts, and we've got studies that show that. Even with a Botox injection, we can lift mild to severe depression.
Because it stops you frowning.
Because that frown has a negative feedback loop to the mood centers in your brain. And that's been shown to lift depression. It's not how it works for everyone, but it does. It's great for if someone is, if you look at the fine lines, the skin quality on people, and just the feedback that they know that their skin feels soft and springy again, and they're hydrated, they feel amazing. They may not look totally different from the outside, but they feel it. And when we feel our skin is healthier, we feel healthier. Because your skin is the largest organ on your body.
Yeah.
Okay.
If you're uncomfortable, literally in your skin, it's not a nice place to be at all. There's still a stigma attached to it, though, isn't there? Some people
to aesthetics.
Yeah, people. Yes. A lot of people still will,
because of the vanity side of it, and I think that's part of our British culture as well, where some other cultures are more open about it, but then there is a good aspect to being a bit more conservative, is that we don't tend to overdo it, whereas some of the other cultures around the world who are more open about it, it tends to be a bit more obvious they've all had work done.
I read a little while ago that it was feminist to have aesthetic treatments if you admit to it, which I thought was quite a nice way around it.
Oh, wow. Are we going to go down
That's very philosophical. Let's go back to the licensing idea then, because from what you were saying, you think there needs to be real blanket change and that the Care Quality Commission needs to be involved in overseeing aesthetics treatments.
That's my view.
But is that really where the government is heading? What's your understanding of what could come out of the guidelines and then consultations that are meant to be happening?
So what the government tends to do, it invites all interested parties to discuss how can we improve the situation. So there have been various committees, including nurses, doctors, surgeons, and beauty therapists that have all been invited to the table to discuss ways forward. And from my point of view, I believe that all of those parties will therefore have some plus point in the final outcome. And that includes the beauty therapists, okay? And for me, they're not medically trained. So I just don't understand how a non-medic can be prescribing or can be using products, medicines, drugs, or whatever, and medical equipment in a way into which have risks in the face of someone of infection, which is the most common complication and happens a lot, but they don't have access to treating that infection. So, so they're included. So my fear is that we're going to have non-medical practitioners being allowed to practice will be granted a license.
There are clearly, though, a number of umbrella organisations for the beauty industry that are very keen to see licensing introduced, some sort of regulation and oversight to professionalise their sector. There's got to be a way, surely, of creating robust training so those practitioners from the beauty industry can continue in their line of work and mitigate against those risks, to reduce those risks, which is exactly what licensing and regulation is supposed to be all about.
Where does it stop? Okay, are we going to just then hand over everything? If you're saying that a type of medical procedure can then be handed over to non-medics, okay, where does it stop?
But it's not regarded as a medical procedure at the moment, is it?
But it is a medical procedure, 100%. It's a drug, first of all, a drug, okay, that's being injected into the body, okay, that can have complications such as infection, occlusion, life-threatening problems, okay. So where does it stop? Okay, the fact that I just don't understand that these are pharmaceutical drugs.
You've admitted that it's, given the stakeholders who are involved in these discussions with the government, it is likely that those stakeholders will continue to be able to administer practice in this space. What then is the best way of ensuring that clients are most effectively protected within those the parameters of reality rather than what you might most like to see?
The best way, I believe, is what I've said.
Yes.
Okay? I think, but that's my view. Okay, what it's like, we have to educate the consumer and explain to them. So societies which represent healthcare professionals need to keep educating the consumer. The government needs to educate the consumer and say these are medical procedures that should be provided by medics. Okay, there has to be medical supervision. It's not just, from what I understand about the proposals, the early proposals, they're looking at regulating premises first, as opposed to the practitioner. Now, for me, it's the practitioner's hands that are going to be, and practitioner's mind and training and medical mind that's going to be looking, assessing, examining, and then performing a treatment. So with every patient that comes to us, we take a history, we examine them, we decide a plan, perform a treatment. Okay? And then if there's any complications or issues, we deal with them ourselves. And if there are major complications, we refer directly to colleagues who can deal with it. That, so that thankfully is rare. But because if we avert complications in our chair, so for example, one of the complications I spoke about earlier was vascular occlusion, so where the blood vessel can be blocked. And that's caused by dermal fillers either squashing, compressing a blood vessel, so that's been injected from the outside, or it's actually injected into a blood vessel and it blocks the blood vessel, a bit like a stroke.
Would you recognise that happened straight away?
Yes. Yes, absolutely. I could see early signs of that, and I have seen early signs, and I've dealt with it straight away before the patient's even known about it. And then I've informed them afterwards what's happened, and I need to keep an eye on them.
Now, you talked about affordability. Some people might look at the price list and think, well, I can't afford that, but I'm still going to go and have it. How do you envisage this industry, if you like, needing to cope with that, to protect people from seeking out the cheapest of the cheap?
There are certain people that will always seek out the cheapest of the cheap, and there's certain people that will always choose the most expensive place to go to, no matter what. Price doesn't determine quality, in my experience. Okay, there are some expensive non-medics, and there are some very, very cheap medics. Okay, it's about the experienced practitioner that should be determining who you go and see.
The whole point of this discussion is about patient protection, client protection. Let's end with that then. What's your advice in the current climate where there isn't licensing, there isn't regulation that you would like to see, and it looks like it could be some way away? What's your advice to someone who is considering embarking on a course of aesthetics treatment, what should they be looking for in the business that they go to, the practitioner that they're going to see, and the choices that they make?
Okay. I get asked that a lot, and I understand how hard it is for people trying to find a good, safe, experienced practitioner. So first of all, I would look up their regulation number, so their registration details. So any healthcare practitioner will have a license, whether it's a nursing license or a GMC license for medics, and look up their registration. And you can check to see the status of that practitioner. So for doctors, for example, you can go to the General Medical Council website and search and see whether you can look up my number and see whether I've been reprimanded, whether I've failed my appraisals, whether I'm up to speed and date, or whether there's any history in mine that's adverse. Okay, and what am I registered as? Am I registered as a GP? Am I registered as a specialist? Or do I not have a specialty? Have I not completed a formal training program? And that opens up a whole other bandwagon of another debate on what medics should be offering this treatment.
So not all should. Not all medics, in your view, are up to this.
Well, there's a question. Because unfortunately, there's a lot of junior medics are leaving the NHS in droves, as we know, and they are going towards aesthetics. But thankfully, there is a new qualification, the level 7 qualification, which they are following. So that seems to be the standard route that most junior medics are taking to go into aesthetics, which is good, but it's not compulsory. They don't have to do it.
In terms of the training that you think that you need to have, give us a flavour of what that looks like.
I think level 7 training is minimum. Okay, level 7 training on medical, and then a period of mentorship.
What does level 7 cover?
Level 7 covers all the pharmacology in detail, the anatomy details, hands-on cadaver sections. It covers complication management. It doesn't just cover the area, it covers the whole spectrum of the specialty as well.
And who oversees that?
Oh, that's organised by universities, it's overseen by universities.
So it's part of a medical training?
Yeah.
Okay. But we know that people are still going to be choosing not to go to see medics, certainly for now. What's the advice?
Look, I can't talk about people who are not interested in seeing medics. You can't teach them. If that's what they choose to do, that's what they choose to do. Okay? I think it's quite, for me, maybe I'm just naive to the fact, but I think it's quite obvious. If you want a medical procedure, you go to. If the government says it's okay for you, if the government says it's okay for you to go to see some non-medical, of course someone can think, I can go to it. Okay, but for most people that go into aesthetic, you want to get word of mouth recommendation. That's the first thing. You want to get, maybe ask your GP if they know. I wouldn't want to take up GP's time in asking about medics, but you've got to look up on the website of the clinic involved. Is it CQC registered? Does it have any registration process? Does it have a license? And then you really do have to speak to the people involved. Either go for a consultation. If they're there and it's clear that they're upselling, walk away. Okay? If they're there and you don't even meet the person who's going to treat you, you're meeting a salesperson, walk away. Okay? You need to see the person there who's going to be treating you, who's reading you, your face, understanding your motivations for attending, motivations for treatment, and also explaining to you risks that you may have concerns about, and also what the treatment plan is, how quickly the treatment plan needs to be put in place, does this fit in with your budget, can we have a treatment plan that fits in with your budget, and also what to do in the event of a concern or an emergency, and then is there a long-term follow-up. Most good places will offer an open door policy to someone. So that means that if there's a concern, they can come and see them straight away at no cost, because that's part of the treatment package. So what you get with maybe in some of the higher priced places is a better service all round. You may get open access, you may get complication management. Private health insurance, for example, for surgeries, covers the complications that can happen with surgeries. And unfortunately, in this country, people don't appreciate that private healthcare is incredibly expensive. Aesthetics is part of that, but it's not as expensive as going to a private hospital for treatments.